It's 9:01 on Thursday morning, March the 19th. Duffy Moon jumping in with Mix Mornings here on Mix 107.5 on the Newsmaker Hotline. We have Lieutenant Governor of the state of New Mexico, Howie Morales, is joining us this morning. First and foremost, good morning, sir. Thanks for coming on the radio with us.
Good morning. Thank you for having me on the air, Duffy.
Happy to do it. And, sir, I want to give you credit because I know you've been doing this, I think, since about 6 o'clock this morning all across the state. So we know that it's a little bit of a broken record for you getting the information out there, but we appreciate you sharing it with the citizens here on this side of the state over in eastern New Mexico. And I want to jump right into it. We're talking, of course, COVID-19. We're talking about the pandemic right now and the state's response and what our citizens need to know. Mr. Morales, what do we know so far as cases in the state of New Mexico?
Thank you. As of noon yesterday, we have 28 confirmed cases in New Mexico, and this is changing daily. We know the counties that have been affected have been Bernalillo, Sandoval, Santa Fe, Socorro, and Taos, and that is why the governor has stressed social distancing to make sure that we prevent the spread of this virus to other communities in the state.
And that's just it. If you look at things that happened, taking other countries even as an example, in Italy, for example, when a large selection of people that were in a hot zone made their way south, it, of course, then quickly spread the virus down south. And so we're trying to avoid having that happen, not just in our state, but across the country. Mr. Morales, if we can talk about yesterday's press conference, if we can talk about yesterday's health order, a pretty big one. Can you kind of give us a recap of the restrictions that came out yesterday?
Absolutely. It was a very informative press conference that Governor Lujan Grisham had conducted. She stressed over and over on that, just social distancing, to make sure you can remain at least 6 feet away from another person, as much as possible to remain home, to stop the spread and making sure that we can have those preventative measures in place. With the health emergency order that went in place yesterday, it did impact all restaurants, bars, breweries, and eateries, which are limited to delivery or takeout only, and really stressing the fact and encouraging a 10-person maximum work environment. This also impacts movie theaters, flea markets, shopping malls, restaurant, recreational facilities, gyms, and spas as well. We've been very fortunate to work closely with our tribal governments and respect their sovereignty, but they've cooperated, and nearly 100% of them have closed or in the process of closing the gaming operations, the casinos, and horse racing facilities, as well in working closely with our hotels, motels, and lodging facilities, which will run at 50% capacity. So these are some of the changes that have occurred, and I can tell you in the radio interviews that I've been in all morning, talking to people across the state, even though there's some concern and some uncertainty, people have generally just been supportive of these and to prevent the spread.
And I know our governor talked yesterday as well about being a good steward of the community and being a good neighbor. I know some have been, there's been some a little bit of panic buying and some hoarding. And I believe as part of that order yesterday, that was addressed as well for certain retailers and capping that which they can sell or the amount. Is that correct?
And that's correct. And I think that when you look and see the concern the governor's stressing is be prepared, but not be panicked. This does extend to if you must go to the grocery store or to do some shopping for essentials, that we recognize that there's not a shortage of supply of paper products, toilet paper, products like that. So just take what you need, leave some for others to be able to have those as well. Our water system and our water supplies are safe. There's no need to take more water bottles than may be necessary. And at the same time is to recognize when you're out there and you're doing your shopping or you're doing your banking, to make sure that you recognize and show kindness and thankful support for all of those individuals who are putting the work in place to provide for us, our first responders, police and fire, government workers at all levels, our healthcare workers, the people at the grocery and convenience stores, as well as our child care providers and our public school workers, churches, nonprofits who are providing meals to our kids on a daily basis. It is stressful times, but the more kindness, the more cooperation that we can show, the better we're going to be able to come out of this.
Let's talk about direct assistance, Mr. Morales. Orders like this obviously are necessary in times like this, but they affect people on many different levels. They affect people personally with layoffs and potentially change in hours at their places of employment, affect business and small business directly as well. On the state level, for those who are affected individually, say through layoffs or adjusted work hours, are there resources on the state level to help those people?
Yeah, and we know that this is difficult. This is painful to all businesses. And every time that an order is made, we understand the impact that has taken place. But we want to make sure that we're providing as much information, as much support as possible. So we would direct that questioning claims for unemployment benefits be made through Workforce Connections. We would stress, if at all possible, to utilize a computer at jobs.state.nm.us to see the eligibility provisions there. If you don't have access to computer, call the 1-877-664-6984 number to access those as well. And these eligibility include for those who have been laid off as a result of COVID-19. For example, those at the restaurants or maybe movie theaters or other areas that have been affected, take advantage of those benefits. Workers who are self-quarantined are directed to be self-quarantined or have immediate family members who are quarantined, access these benefits. And then those workers who have had their hours reduced as a result of the virus and COVID-19 changes that have occurred. Workforce Solutions, I've been in communication with Secretary Bill McCamley every day. I can assure you that they're working diligently to make sure and provide these benefits to people across the state.
And for business owners, small business owners, medium-sized business owners, local business owners, it's affecting them, of course, with a potential loss of revenue and things along those lines. If they're having to lay employees off, there may be concern about employees going out and filing unemployment. But I do believe on the state level, you guys have stepped in to try and help with that as well.
We have, and we always say that small business is the backbone of our state, and it still is, and will continue to be. Working together with the federal government and providing assistance to those small businesses is key as well. And I think that we'll continue on a daily basis to make sure that we're providing for those individuals and accessing information through our economic development department and ensuring that we can provide, whether it's small business loans or other type of services. The state of New Mexico is here to assist those businesses as much as possible to come out of this with the least amount of impact.
It's Lieutenant Governor Howie Morales joining us here on Mix 107.5. It's 9:08, and we're talking COVID-19, the coronavirus, the pandemic, and how it's affecting our state, how it's affecting us locally here on the High Plains. And we're seeing an escalation quickly, Lieutenant Governor, and I think that we're seeing that across the world, really. Here in the United States, over the past week to 10 days, things have changed drastically. Here in our state, they've changed quickly as well. Has there been any talk in Santa Fe? Because I know citizens they're concerned, they're worried, they're uneasy right now. Has there been any talk in Santa Fe about what's next? What's the next step? What's the next order that potentially you're looking at? You hear things about curfews in other communities and things like that. Is that being discussed at this time?
And so I know that there's discussions that have taken place all over the country, and I give credit to our governor and to all of the leaders in our state agencies who are working to make sure we can think of every possible scenario to protect New Mexicans. I know me personally, I'm actually self-quarantined because I traveled to Washington last week and want to make sure that we're practicing what we preach, showing that responsibility and not putting anybody in harm's way. But as far as other orders, those things may change daily. I think that we're at a good point right now where we've stressed the fact of social distancing, stay at home as much as possible, providing support for those impacted with employment, as well as providing information. We're not at the point where other states and other places like San Francisco or New York City have gone to with sheltering in place. We're not doing that. What we're stressing again is social distancing and making sure that people take that seriously so that we don't have to later come back and take more drastic measures. Airports are still open, and we want to make sure that we recognize again as much as possible, be proactive, stay home, limit travel, making sure that we can allow science and the medical side to really get a handle of this and to provide that immunity as quick as possible.
And like you said, things are changing almost daily. And as that information becomes available, you'll hear it here on Mix 107.5 and the Rooney Moon Broadcasting group of radio stations. If we can switch gears just a little bit, Mr. Morales, and again, we appreciate you spending some time with us. I know students and educators were really first to be affected by all of this with the mandate that came down from the Public Education Department for a 3-week stay of going into class. And to me, that made sense at the time. Are there discussions of canceling state testing for this year? I know that they are doing that in other states. Is there any talk from the Public Education Department that you're aware of canceling state testing?
Yeah, and I can say personally that the impact of that, I have 2 children who are in elementary school, and knowing the impact that's taken place there, I think that the public ed has been in communication constantly with our school districts, who have shown wonderful collaboration and support during this time. We do know that we've moved the testing date window, where the testing date window has been shifted back, and continual discussions and continual preparations. If we go in fact, eliminate state testing or suspend state testing, those are discussions and plans that are in place. And the governor has been very clear to our public education department is look at every single possible case scenario. I was personally on a conference call with lieutenant governors across the country, and states are moving towards possibly preparing to not go back to school this year. Those are things that we'll get information once it's available out to the public, and making sure that people understand that these are all preventative measures that we're going to take to protect each New Mexican.
And not decisions that are made either easily or lightly. Those who are potentially or feeling the effects, those who, and I mean health-wise, if they're starting to maybe develop a cough and they're getting worried, there's a lot of talk out there and a lot of questions surrounding testing for COVID-19. What are current testing procedures in the state of New Mexico?
And that's a great point, and I'm glad you mentioned that, because what we don't want to do is we don't want to overwhelm our hospitals and our healthcare facilities. We want to make sure that people are clear if they feel that they're exhibiting any type of symptoms or come into contact with any person who may be exhibiting those, that first and foremost that they call, that they do not go to the doctor without first calling the hotline, the health hotline, which is 1-855-600-3453, and I'll repeat that, 1-855-600-3453, to make sure that you can have a screening that takes place there. Now, individuals who have non-medical questions about volunteering, donating, childcare, food supplies, transportation, other areas there, go to newmexico.gov, and they'll have information in place there. We want to make sure that people that are showing any symptoms are prioritized right now. And as we speak, there's potential of mobile drive-through test sites that are being developed. Right now, I know in Roswell, Las Vegas, Las Cruces, in Albuquerque, and potentially in Taos, those set-up sites are taking place. With more, I'm sure, to come as the federal government is able to provide more of those tests. Again, is only get tested if you're currently exhibiting those symptoms being fever, dry cough, or shortness of breath, so to ensure that we're not overwhelming our healthcare system.
You just spoke to it, and that being that there are potentially testing sites drive-through being set up in Roswell, still a 2-hour drive essentially from where we are on this side, and so it's more of a federal government look at to see if there'll be closer locations for that?
Yeah, we want to make sure that there's more availability so we can have more people who are exhibiting those symptoms be tested. And the governor's been adamant to make sure that New Mexico is going to get its share of what's needed to be done to test and to protect our residents.
I know you're a busy guy this morning, Lieutenant Governor Howie Morales. Just a few more quick questions for you. And again, we appreciate you giving so much of your time to us here in Clovis, Portales, and the surrounding area. Got to talk about travel a little bit. And it's a little different over here on our side of the state, sir, in that we are, 6 miles essentially from the state border. And so there are a lot of folks here that live in Clovis, live in Portales, live in this area that work in Farwell, Texas, that work in Friona at the meatpacking plant, that work in Muleshoe and things of that nature. And to keep their livelihood, they are forced to cross that state line on a daily basis. There are people here that go into Lubbock on the regular for medical appointments that aren't necessarily available here in our small towns. For those people, I know that there are certain travel restrictions. What do you recommend for those people? Status quo? Should they be calling ahead? What do you recommend?
Again, we want to recommend as much as possible for people to remain home to do that. And I understand that that's not always the case there, but just to use those preventative measures of continually staying in that social distance aspect, continually keeping that space between individuals, and as much as possible limit travel that would cross our borders, whether it's state borders or international, to limit that. I would see if there's any other options that are available for people to, you're right, to call in to see what could be done. But these are the stressors that we're continually getting out there, is to stress to really take those precautions as much as possible.
And Mr. Morales, if they do have to cross into Texas, again, the proximity here is the issue for us over on this side of the state. If they do have to cross in to go to work or whatever the case may be, are you recommending that they still call the health line, on a daily basis to say, hey, I've crossed into Texas and crossed back, or is that overkill at this point?
Well, I think that goes into, again, for the non-medical questions, and going to that 1-833-551-0518 number or the NewMexico.gov website, and to be able to pose those questions. Again, we want to make sure we're being as informative as possible and preventative as possible. And this is one way to do that for those that just can't refrain from having to go across those lines.
Makes sense, sir. You've been very helpful. I want to give you one more opportunity to get out the resources that the state on the state level have made available to residents and citizens of New Mexico. The phone numbers that you guys have in place, the websites that you have in place. If you don't mind sharing those one more time so our listeners can write it down, can take stock of that if they do have any more or any further questions.
Absolutely. And again, I want to thank all the people from the state of New Mexico who have come together in this difficult time, our healthcare workers, our first responders, our providers, as I said earlier. We want to make sure we continue to thank them. If people have questions or claims for unemployment benefits, contact Workforce Solutions, preferably through the website at jobs.state.nm.us. Or if you don't have access, then use the phone number at 1-877-664-6984. Again, that's for unemployment benefits to Workforce Connections. I also want to make sure that people who have any questions when it comes to symptoms that they may be experiencing on the healthcare side of it, don't go to the hospitals or doctors without first calling the health hotline, which is 855-600-3453, or going to the website, which is cv.nmhealth.org. If you have non-medical questions like the ones that you had posed, call the number at 1-833-551-0518 or access the NewMexico.gov website for those non-medical questions.
So Lieutenant Governor Howie Morales, very informative, very helpful. We appreciate the state level government reaching out to all communities across the state to get the information out there. We know you're busy. We know you have to go. We appreciate you spending some time with us here on Mix 107.5.